Everything you thought you knew about the golden years is wrong. While we're focused primarily on youth mental health, there's a silent epidemic killing our seniors at alarming rates. Suicide among older adults has risen 5% in just 3 years, and drug deaths have skyrocketed by 58%. But here's the shocking truth: fewer than 40% of seniors with mental health disorders ever receive treatment. Today, we're exposing the crisis no one wants to talk about. Introduction. Hello, this is Alan, and if you have aging parents, grandparents, or if you're approaching your golden years yourself, this video could save a life. We're diving deep into America's hidden mental health crisis, one that's claiming more senior lives than ever before yet remains largely invisible to society. The statistics are staggering. Men over 65 have suicide rates 6 times higher than women their age. Adults 85 and older are the second most likely age group to die by suicide. And here's the most heartbreaking part: when seniors attempt suicide, 1 in 4 will succeed, compared to just 1 in 200 attempts by young adults. But this isn't just about numbers. This is about our mothers, fathers, neighbors, and mentors who are suffering in silence. The shocking reality. Let's start with the facts that will shock you. According to the latest America's Health Rankings 2025 Senior Report, we're witnessing unprecedented mental health deterioration among our elderly population. First, the suicide crisis. Between 2018-2020 and 2021-2023, suicide rates among seniors rose to 17.7 deaths per 100,000 adults aged 65 and older, the highest rate ever recorded. But here's where it gets even more alarming: there's a massive gender disparity. Men's suicide rates are reaching 32.6 deaths per 100,000, while women's rates are 5.4. That's a 6-to-1 ratio. Second, the drug death epidemic. Drug-related deaths among seniors increased by a staggering 58% in the same period, jumping from 8.4 to 13.3 deaths per 100,000. Again, men are disproportionately affected, with rates 2.6 times higher than women. But perhaps most tragic of all, nearly 14% of adults aged 60 and older live with a mental disorder, yet fewer than 40% receive treatment. We're literally watching our seniors suffer and die while help exists but remains out of reach. Think about this. While seniors make up only 16.8% of the population, they account for 22% of all suicides. In 2022 alone, out of nearly 49,449 suicides, 10,433 were seniors aged 65 and up. The perfect storm: why seniors are so vulnerable. So why are our seniors facing this crisis? It's what experts call the perfect storm of factors that create unprecedented vulnerability. First, there's the epidemic of loneliness. Dr. Tia Dole from the 988 Suicide and Crisis Lifeline calls it exactly that: an epidemic. Nearly 30% of seniors living alone report feelings of loneliness. Imagine spending decades building relationships, only to watch them disappear one by one. Your spouse of 50 years passes away. Your lifelong friends move to assisted living or die. Your children live across the country. Suddenly, you're trapped in a world where human connection, the very thing that kept you going, has vanished. Second, the age of loss. As Dr. Regina Cope, a Stanford-trained geropsychologist, explains, seniors face multiple devastating losses simultaneously. It's not just losing people, it's losing independence, losing the ability to drive, losing your identity as a productive member of society. Retirement, while anticipated, can strip away the sense of purpose that defined you for decades. Third, the physical health crisis. Approximately 80% of older adults live with a chronic disease, and 77% have at least 2. Imagine dealing with arthritis pain every morning, diabetes complications, or cancer treatments while also grieving the loss of your spouse. The physical and emotional pain compound each other in a vicious cycle. Fourth, there's cognitive decline. People with mild cognitive impairment and dementia have higher suicide risks because declining cognitive function affects decision-making and increases impulsivity. You're not just losing your memories, you're losing yourself. And finally, there's the stigma. Many seniors grew up in eras where mental health was never discussed. Seeking help was seen as weakness. This generational silence means they suffer alone, believing their pain is just part of getting old. The warning signs no one talks about. Here's what's terrifying: the warning signs of senior suicide are often dismissed as normal aging. But they're not normal, and recognizing them can save lives. Watch for these critical red flags. Social withdrawal from activities they once loved. Medical non-compliance, skipping doctor's appointments or not taking medications. Neglecting personal care, not grooming, wearing the same clothes repeatedly. And here's a big one: giving away beloved possessions or suddenly revising their will. Listen to what they're saying. Phrases like, "I'm a burden to my family," "I'm in unbearable pain," "I feel empty and hopeless," or "I feel trapped with no way out." These aren't just expressions of sadness, they're cries for help. But here's the most important thing: contrary to old beliefs, asking someone directly about suicide does not increase their risk. Dr. John Sanitato, a geriatric psychiatrist, advises asking directly, "Are you thinking about suicide? Have you had thoughts about suicide?" Keep asking, because it shows someone cares. The key is recognizing that these signs are most dangerous when they occur together. One isolated symptom might be normal aging, but multiple signs together signal a mental health crisis. The deadly difference: why senior suicide is more lethal. Here's the most heartbreaking reality: when seniors attempt suicide, they're far more likely to succeed. 1 in 4 senior suicide attempts results in death, compared to 1 in 200 attempts by young adults. Why? First, seniors are physically frailer and more vulnerable to injury. Second, they're often more isolated, making rescue difficult or impossible. Third, they plan more carefully and use more lethal methods. Fourth, even if they survive an attempt, they're less likely to recover due to underlying health conditions. The American Association for Marriage and Family Therapy suggests that elder suicide rates are actually underreported by 40% or more due to silent suicides, overdoses, self-imposed starvation, dehydration, or accidents that are actually intentional. This isn't just about individual tragedy, it's about losing decades of wisdom, experience, and love that our seniors represent. Hope and solutions: the revolution in senior mental health. But here's the good news: this crisis is preventable, and revolutionary solutions are emerging. First, technology is transforming senior mental health care. AI-powered wearable devices can now detect depression and anxiety symptoms with 95% accuracy. Smart medication systems prevent dangerous errors. Telehealth has improved access to mental health services, reducing hospital readmissions by up to 50% and emergency room visits by 24% among seniors. Second, innovative community solutions are fighting isolation. Intergenerational living communities, where seniors live alongside college students, are showing remarkable results. Programs like Enhance Fitness report 35% improvement in physical functioning and 53% reduced rates of depression. Third, there's a mental health revolution happening. The 988 Suicide and Crisis Lifeline now offers 24/7 support specifically trained for older adults. SAMHSA's 2025 national guidelines are making crisis care more accessible and effective. Fourth, personalized wellness programs are becoming the new standard. Instead of one-size-fits-all solutions, seniors are getting customized exercise regimens, cognitive training through smartphone apps, and holistic therapies including meditation, yoga, and even pet therapy. And here's something incredible: depression in older adults is very recoverable, according to experts. With proper treatment, including medication and therapy, seniors can and do recover fully. Take Sherry Adler's story. At 72, she attempted suicide after feeling hopeless and isolated. Today, after receiving proper mental health care, she's thriving and helping others. Her recovery proves that it's never too late to heal. What you can do right now. So what can you do right now to help save lives? If you're concerned about a senior in your life, be present. Make that phone call. Schedule that visit. Ask directly about suicide, it could save their life. Help them access care. Connect them with the 988 Suicide and Crisis Lifeline. Help them find local mental health providers through SAMHSA's directory. Follow up consistently. Studies show that simple follow-up calls, texts, or cards can reduce suicide-related deaths. If you're a senior watching this, know that seeking help is a sign of strength, not weakness. Your life has value. Your experience matters. Help is available. For immediate help, call or text 988 for the Suicide and Crisis Lifeline. It's free, confidential, and available 24/7. Conclusion and call to action. The silent epidemic of senior mental health doesn't have to remain silent. By sharing this video, you're helping break the stigma and potentially saving lives. If this video opened your eyes to this crisis, please leave a comment and share it with someone who needs to see it. Please subscribe for more content that tackles the health issues that matter most. And remember, in a world that often overlooks our seniors, your awareness and action can make the difference between life and death. Together, we can ensure that the golden years truly become golden for everyone. Thank you for watching and caring.